I am the president of the Patients Association, but I started the work for that association because I have experience with withdrawal of antidepressants. It was 5 years ago that I had a lot of problems. We moved from the Caribbean to Holland again. The weather was bad here and everything changed in my family. And I got depressed, and I didn't want to get the medication at first instance, but it got worse and worse. So my general practitioner proposed me, maybe you can take the antidepressants. So I took them for 5 or maybe 6 months. And the problem was that I was really, I felt dumb feeling. And it's very difficult to recover in a way. It's more difficult to get or to stay in contact with your environment, with your relatives, and I thought it's so important. So I tried to get off it in a safe way, and I came on to the tapering strips online, and I asked my general practitioner, maybe you can prescribe them for me, and it was a success. I didn't have any withdrawal symptoms, so I was very enthusiastic. And then the pharmacist here in Bavel, he asked me, maybe you can do something for the Patients Association. And that is now 3 years ago, and that's why I'm now here the president of the association, together with more people, of course. But day to day I am in contact with the patients who have questions about how can I withdraw, what's important to take care of, with whom can I speak, can I ask you questions. All those kind of things are my daily life now. I think it's very important that we increase the knowledge as well as in the patients as in the doctors, because we have those medications for many decades now, and there was not a lot of attention for the problem that people are experiencing with the withdrawal. And I think it's important because those medications, it's not meant to use your whole life. There are exceptions to that rule, of course, but most people can get off them after they have their depression and they feel better. And the next step is how can I live without the medication? And I think one of the biggest problems of the last 10 years was the doctors know that, but they don't know how to do that in a safe way. And the patients, they often had a lot of fear before they started the medication, and they feel the fear for the fear they will experience again when they try to reduce their medication. So it's very important for the patients and the doctors to know how can you do this in a safe way. When you have seen your mother, your father, or anyone else in your family seeing going down and have a depression, and sometimes it's very it gives a lot of uncertainty in the family. And when someone have a good response on the medication, they want to not to change the winning team. They're very glad that the things are going better. And then the patient says, okay, I want to reduce my medication or maybe stop it. And sometimes the relatives, the family says, no, don't do that. Everything is okay now, don't do that. But what I told, for me personally, it was the main reason to withdraw and to want to stop my medication, because I felt numb to others and I want to change that. I want to go back to my normal personality from before the medication. So a lot of people feel the same way. But the step to go to your doctor and say, okay, I want to stop it, it's difficult. And also the doctor, he will not be 100% enthusiastic to that idea, I think. And then they start to reduce it with or without tapering strips. But they don't succeed. At some point they have the feeling that they will not succeed because they have symptoms and everyone tells them, okay, you are back to what you were, stop it. because you will not be successful. And I think that must be very frustrating for patients to hear that or to feel that. I think it's important to follow your patients also when they start the medication, because they are very vulnerable the first weeks, month. We all know that when you increase or decrease the dosage, it's a risk, because when people feel depressed again and they feel suicidal, the first thing they do is to avoid contact, also with their doctor. So I think it's very important, and that's what happened to me. I think when the people are losing their contact with the doctors, that must be an alarm sign. You have to call them or to ask them to come to the practice, because then something is really going wrong. So don't wait too long, and when the patients don't call or don't come, go after them. I think that's very important. Withdrawal of those medication is a kind of science in progress. We learn from each other. It's an individual thing, so everyone is different. But there are a kind of red lines you see appearing. So I think we have to learn from each other, doctors from patients and the other way around. I think it's very important. What we know is that more than 3 million patients are using psychiatric medication here in Holland, and we think that 1 million antidepressants. Half of the people are using the medication, but not because they have a depression, but because they can't get rid of it. They can't stop it. One of the things that we want to do for the patients is to build up a kind of buddy system. Because a lot of them, what we hear and what we see in our mailbox every day is that people need someone to talk to who have the same experience as they have. And I think that's one of the things that we want to do in the future. That we build up a system that, for example, when you want to get rid of your paroxetine, that you can have contact with someone that already was successful in tapering. So you can ask those things, and when you call 3 times a day because you feel so terrible, it's no problem, and they understand it because they went through the same thing. I think that's so important, that people are supporting each other, and that's one of our goals for the future.